Okay, this is a wonderful question. A lot of families reach out with very similar type questions where the focus is on why isn't my child verbalizing with the doctor or the dentist or the teacher or an aunt or an uncle? And the overwhelming focus is verbal, verbal, verbal. Selective mutism is a social communication anxiety, and I would want to understand this 15-year-old's baseline stage. What are they able to do in that particular setting? If we can start there and understand that, we're not going to be focusing right away on verbal. Maybe this 15-year-old really doesn't engage even non-verbally with somebody. Maybe they're very anxious, they're shut down. Maybe if you ask a choice to try to bring them into the conversation, just a basic choice, they're not even able to turn to you and tell you. So I'd want to understand the baseline stage and think about the bridge. I also feel that perhaps there's been a lot of pressure and expectation for speech. Now, for a 15-year-old that can speak, for example, let's say the doctor says, "How old are you now?" And your child is able, after some time, to be able to answer quiet one or two words. That's good. What I have learned over time is that teenagers, over time, are able to speak. They're just not necessarily elaborative, initiative, expressive, and in a regular volume. And their lack of comfort with verbalization is probably a result of the lack of opportunity. So seeing a doctor and authority figure can be really tough. If your child doesn't have a lot of experience with doctors, dentists, and so forth, especially in lieu of COVID, definitely kind of backing up and working to prepare for a setting. One thing we do with older kids is something called an action plan. Where are we going? Who is going to be there? What are questions that somebody could ask you? What are the answers to those questions? And what can you ask? So we want to really prepare in advance for social situation, and also train parents to be able to offer maybe a simple choice question if your child gets a little nervous. So, it gets awkward when it's really basic questions like how old are you? What grade are you in? What's your school's name? So practicing that is important. Also educating the doctors, making sure that the doctors that you see, the dentists that you see, are aware of your child's selective mutism, and maybe in this case, their complete inability to speak. So no matter how much you prepare in a very positive way, your child is still mute. That is something we have to work with in therapy, that we really need to help your child progress across the bridge. So if your child has selective mutism and they're in, let's say, stage 1, where they're nonverbal and maybe not even comfortably nonverbal, we definitely want to make sure that those interacting with them are aware. So educating through the About My Child, and some of the older kids and teens actually create their own sheet called About Me that they're confident in giving that. Like, I have difficulty communicating. Please ask me questions in this way. By far, that's not the majority. So as a parent of a 15-year-old or any age child, I would recommend educating others who do interact. It could be coaches, it could be teachers, it could be extended family members, dentists, doctors, especially authority figures and those that they don't see much, about the best ways to interact. And for a child that's not verbal, asking a yes/no question just to be able to get them through that moment. We're not looking at the doctor's office as a time to kind of hit the jackpot in progressing into speech. We just need to get through that moment in that time. So that's not where we're going to practice our goals, at least not right now. Of course, that's an area that we're going to progress in, but that may not be the area that you're really trying to prompt next steps in communication because of the anxiety of going to a doctor. So almost bridging down, accepting where they're at is what I recommend. So asking yes/no questions, giving them the opportunity to write their answer and show it, to be able to point, to be able to gesture, even for you to turn and ask a choice question to bring them into conversation. And that's something we would talk to your child about, their comfort in doing this, because again, a really big part of treatment is their involvement in this. But I do want to mention something, that we're talking a lot about older kids, and I do need to say that the older the child, teens, even adults, the more they need to be involved in this. We as adults cannot set the world up for them in every situation. They need to be actively involved in their goal setting, their awareness to what they're doing, how they're doing it, when they're doing it, where they're doing it, their acknowledgement and their assessment of their feelings, and really respecting that. When I work with teenagers, actually any age child, 3-year-olds, they have to relate to a feeling. And using that ability to rate and grade their feelings, in this case, a 0 to 5 perhaps, where 5 is the hardest and 0 is the easiest, and really trusting them. So knowing we're going to go to the doctor, I'd want to talk to your child about this and plan out that visit in a very positive, upbeat manner and help them accomplish what they can do. But trusting their feelings, acknowledging, assessing it, rating it, being able to talk through the different stages and what they're comfortable with, knowing that we're going to be giving them a little more than, let's say, a 0 in terms of comfort. 5 is the hardest, but maybe working towards a 2 or a 3 out of 5 to be able to get through situations. Also, the older the child, the more it's difficult versus scary to do because the behavior becomes very conditioned. And I did mention that the older they get, the more they're involved in active goals. And the more cognitive this is, the more they're aware of their feelings, how they react to their feelings, and how do we help them change their behaviors. Internal motivation is really important. So going to the dentist or the doctor isn't exactly motivating for them necessarily. So that may not be an area that they're even willing to practice anything in terms of goals. So they do need to be motivated in their treatment and finding areas that they can be motivated in. So it is important because external motivation as you get older isn't as effective as it is with younger kids. So that internal motivation, helping them realize what they want to accomplish and what their goals are. So I hope that's helpful.